The first phase of the rapid antigen test drive will be a one-week validation process. This will ensure the reliability of the diagnostic tool. The Health Ministry recently reported that it was experiencing a delay in COVID-19 test results due to the increasing number of cases. The SLMDA proposed that the ministry use rapid tests to help with the backlog. Persons at select clinics will be offered this form of testing, but will also receive a PCR test.
In an effort to scale up testing for COVID-19 nationally, the Ministry of Health introduces the rapid antigen test at specific points of care. The testing option shall commence through a two-phase approach. The first phase shall focus on the validation of the test, which is a standard activity prior to the full-scale introduction of any diagnostic test. In this validation phase, people who come for COVID-19 testing at the Victoria Hospital, Owen King European Union Hospital, the St. Jude Hospital, and the VG Sports Complex testing outpost will be offered antigen tests. The validation phase covers a one-week period and is expected to be completed by February 13, 2021. Due to the high prevalence of COVID-19 in St. Lucia, any individual with symptoms suggestive of COVID-19 who tests positive on an antigen test is considered a confirmed COVID-19 case. However, while the validation phase is being undertaken, anyone presenting for testing at the clinics which were previously mentioned receives both an antigen and a COVID-19 PCR test.
A swab from the nose will be taken just as the PCR test. A negative result will need to be confirmed with a PCR test.
It is important to note that a negative antigen result does not necessarily mean the absence of COVID-19 infection, particularly as it is possible to get a negative test result despite having symptoms suggestive of COVID-19 or being a contact of a confirmed case. In such instances, the antigen test must be confirmed with the DNA PCR test. Individuals who receive a negative result on an antigen test should confirm that diagnosis with a PCR test and continue to quarantine at home until receipt of their DNA PCR results. The antigen test detects the presence of a specific protein of the COVID-19 virus.
Acting National Epidemiologist Dr. Dana da Costa Gomez detailed some advantages of the antigen tests, one of which is the quick turnaround of results.
They are fairly inexpensive. The test can be used within non-health settings as well as within clinical settings where individuals seek care, such as respiratory clinics or hospital emergency rooms. They provide results in approximately 20 minutes. There is no need for highly technical staff to perform the antigen test. The antigen test allows for rapid detection and isolation of cases, particularly those people presenting with symptoms. The quick turnaround time of test results allow for faster identification of high-risk contacts of confirmed cases.
The second phase of the rapid antigen testing option will see select respiratory clinics becoming dedicated antigen testing sites on island. Gina Filippi, HCS News Force.